Hello friends, so today we will start talking about the studying the anatomy and physiology of the spinal cord. So our contents include would be our introduction, gray matter, white matter, tracts of the spinal cord, which includes your ascending tracts and descending tracts. So let's clear all the terms one by one. If we talk about the introduction, let's say what is a spinal cord? Spinal cord is what you say? Any idea? Yes. Spinal cord is what? It is actually a, you can say, very important in your body. And if we talk about where it is present, for example, we'll see for it is a brain, pons, medulla, and this is your spinal cord, right? And this is your cortex. This is a very rough diagram, but for a physiological diagram it is not an anatomical diagram, but for understanding, see the purpose. See, it is the brainstem. It is a brainstem which includes your midbrain, pons and medulla. Fine. And if we are talking about the spinal cord, see, this is the foramen magnum, the opening. This is called the foramen magnum, and your spinal cord starts from here and it continues down down to the L1 vertebra. Fine. See, it is a continuation of your medulla oblongata. For example, it is here midbrain and here pons and medulla. So it is a continuation of the medulla oblongata above, and it extends down from the foramen magnum. It is an opening in your skull through which your spinal cord descends down, and it terminates at the L1 vertebra. So the spinal cord is your this one. Fine. Which is running from your medulla oblongata to the L1 vertebra. So if we talk about we have the we have the vertebrae down also. So where the spinal cord terminates at the L1 only, right? Then what is left behind in descending part, that we will discuss in the later part. Fine. So if we see, we will talk about the spinal cord situation, that where is it situated. We have already discussed what is the extent of it, coverings, segments, spinal nerves and roots, gray matter and white matter. These are the very basic things. So before, if you do not understand it, you can't understand the anatomy of the spinal cord and what is the physiology of the spinal cord. To understand it, we have to discuss these all the terms so that it is clear when we are going to discuss the anatomy of the spinal cord. So these are very basics. Try to understand it so that you can find very easy the anatomy and physiology of the spinal cord. Fine. So one by one we will clear the terms, that what are the terms. If we see, see, first the situation and extent. So if you see, the spinal cord is situated where, for example, we see that these are your vertebrae. Fine. These are your vertebrae, and above in front of the vertebrae there is a canal. If you see, in the spinal canal means your vertebra is the covering of your spinal cord. For example, you have the skull. This is your skull, in which your brain is protected, right? This is your brain. This is your brain, So brain is very delicate organ which is protected by your hard covering which is called the skull. Fine. Likewise, your spinal cord is also very delicate organ and it is protected by your what? Say, okay, think for for few seconds and just comment me in the comment section what is the answer of it. It's very easy. Your spinal cord is protected by your vertebral column. Yes, right. Very good. Fine. So your vertebral column is the means protective covering of your spinal cord, and which is in the vertebral column. If you see the spinal canals, there your spinal cord runs, and spinal cord runs in your CSF, that is cerebrospinal fluid. Fine. Cerebrospinal fluid. Okay, now you know the extent where the spinal cord is situated. It is situated in the vertebral canal, and extent we have already discussed that it is extend from your medulla oblongata through the foramen magnum to the L1 vertebra. Clear? Clear? So we proceed to the next topic, that coverings. So according to you, what are the coverings? Any guesses? Yes. See, this is the spinal cord, right? And we have some covering over it which is protecting it. Okay. See, spinal cord is covered by your coverings which protect your spinal cord. It is very delicate organ and it is protected by many things. And this protection is called your meninges. Okay. Meninges are what? These are the coverings of your spinal cord. And if you see, these coverings are continuation of the brain also. This brain is also covered by your meninges. So likewise your spinal cord is a continuation and it is also covered by the meninges. What are the meninges? Any guesses? Meninges are the coverings of your brain and spinal cord. Fine. And if we talk about the meninges, we have the three coverings which protect the spinal cord as well as the brain. These are called the dura mater, your arachnoid mater, and your pia mater. Very easy to remember. There is nothing which you have to memorize in your neuroanatomy. It's just you have to understand it. If you understand it, it will very easy for you to memorize it. See, for example, we have the three coverings. Fine. These are called your meninges, which are the protection of your brain and spinal cord. These are called the dura mater, arachnoid mater, and pia mater. So you can learn it with the very simple mnemonic, means I have learned it like this, DAP. Okay. So it is the reason, so because I have placed it in this position, because dura mater is your outer covering, arachnoid is your middle covering, and pia mater is your inner covering, innermost covering. So I have learned it in this mnemonic DAP. D is for dura mater, A is for arachnoid mater, and P is for pia mater. Fine. So your coverings are also complete. Now you have learned it. And the next one is your segments. So what are the segments of the spinal cord? Any guesses? You have learned it. Just comment me in the comment section box. Answer me. Okay, fine. What are the segments of the spinal cord? We have how many segments? We have 31 segments in the spinal cord. Let's see how. First is your cervical segment, second is your thoracic, very good, third is your lumbar, fourth one is sacral, and fifth one is your coccygeal. Okay, these are the segments. So how you can say how I have written the 31 segments? Let's see how I have written. We have the 8 cervical segments, 12 thoracic segments, 5 lumbar segments, 5 sacral segments, and 1 coccygeal segments. Okay, so these are the segments. How see, we have the 7 cervical vertebrae, but we have the 8 cervical segments. How? Anybody can answer? Okay, I'll give you just a few seconds. Answer me in the comment section or pause the video. Just think of it and just continue it. Okay, I'll tell you how we have the 8 cervical segments. See, we have the C1, C2, C3, C4, C5, C6 and C7. We have the 7 cervical vertebrae. Is that right? So how we have the 8 cervical segments? Because your first segment is from above the C1. What is there? Occiput. So your first cervical segment is exiting or starting emerging from your between your occiput and your first cervical vertebra. Fine. So this is your first cervical segment. Likewise, this is C2, C3, C4, C5, C6, C7 and C8. Done. Now you understand why we have the 8 cervical segments? Yes. Is it clear now? Okay, I'll make you understand by taking the new slide. See, it is very important to understand this. Otherwise, if you know that if you come across with a patient of the spinal cord injury, so you have to see at what level the patient got injured. So according to that, you have to imagine that how much injury the patient and what are the symptoms patient is getting. From the level you can count that how much patient is suffering or how much he can or she can suffer from. Fine. If you know the level, it is very easy to make your half of the diagnosis, means many symptoms are according to that only. So see, we have seen the cervical segments. We now know that we have the 8 cervical segments. I told you how. 12 thoracic segments. We have 12 thoracic vertebrae and 12 thoracic segments, 5 lumbar segments, 5 sacral segments, and we have the 4 coccygeal vertebrae, but it is fused to form the one only. So we have one coccygeal segment. So if we add on it, we have the 8 plus 2 is 10, 10 plus 10 is 21, and 2, 3, 31 spinal segments. Got it? So our next topic is nerve roots. See, how you can see the nerve roots. See, for example, we have talked about the segments of the spinal cord, right? Any doubt in it? Please watch the video very carefully, and if you have any doubts, please let me know in the comment section. I'll try to clear it. See, we know we have the 31 spinal segments, and we have seen how it is. Now we will see the nerve roots. See here very carefully that, see, we have seen we have the 8 cervical segments. And what are the nerve roots? Nerve roots are nothing but these are the nerves only, extension of the nerves which are arising from your segments. We have studied the segments. Now these are the roots, means these are the like tree branches of the tree are the extension of the tree only. So the nerve roots are your segment, so the nerve roots are your extension of your segments. We have seen that the first cervical segment is here, fine. So from this segment on both sides the nerve getting exiting, which is called your which nerve? Yes, very good, which is called your C1 nerve root, fine. So likewise we have the C2 nerve root which is exiting from your second cervical segment, very good. So this is your C2 nerve root on both the sides. Likewise we have C3, C4, C5, C6, C7, C8. Easy? Very easy on both sides. So on both sides it is. It will follow the same fashion. Is it any difficulty up to here, or it's clear? Yeah, now this is your which nerve root? Any guesses? It's very easy. Very good, T1. So now if you have to see, I'll make you one question. Pause the video and just see the answer afterwards. So if we see the level of the spinal, level of the vertebra, and level of the spinal cord, are they same? Tell me. Pause the video, just think of it and just then see the answer. Okay, see, your cervical first nerve root is exiting from your between your occiput and C1 vertebra. So if we see we can explore that your cervical nerve roots are exiting above the spinal level, fine. It's very easy. If I ask you that your C1 nerve root, this one, your C1 nerve root is exiting from where, you have to say between your occiput and C1. So it is above the level. C1 segment of the spinal cord or C1 nerve root is above the C1 vertebra. Fine. If the patient got injured here, so your C1 would be spared, because it may have the more chances to probably injure this nerve root if he got the injury on C1 level of the vertebral level. So we have to see the different levels of the vertebral level, on spinal level, and on nerve root level. Fine. So if we see, your cervical nerve roots are above the vertebral level, above one vertebral level. And if we talk about the thoracic, see, thoracic or below that, we have the nerve roots which are exiting below the vertebral level. How? If it is T1 vertebra, your T1 nerve root is exiting from below your T1 vertebra. Fine. Likewise, we have T2, T3, means in the same fashion. For example, your T2 vertebra is this, and nerve root which is exiting from here is your, what would be the answer? If in the thoracic vertebra we have talked that it is the nerve root which is exiting below the vertebral level, so your nerve root would be T2. Very good. And here T3, and in the same fashion downwards. So whenever the question came in your exams, you have to write that the cervical nerve roots are above the vertebral level, and below that, from the thoracic to tail end, we have the nerve roots which are exiting below the vertebral level. Fine. Now you understand the concept that how it happens. Yes, we have to understand the basic, otherwise if you memorize it, you will forget it. Fine. So to learn it, you have to know the concept of it. So your spinal nerves and nerve roots are also clear, segments are also clear, coverings are also clear, situation and extent is also clear. Let's move to grey matter and white matter. Just a minute, I'll take a new slide to make you understand. See, if I draw here, for example, first let's clear the concept of grey matter and white matter. Any guesses? You know what is grey matter and white matter? Anyone? It's very easy. You all have studied the structure of neuron. Fine. Which is your basic unit of your brain. Means it is the fundamental functional unit of your brain cell, which is neuron. Fine. So if I draw the structure here, this is the structure of neuron. Clear? Tell me if I am wrong. It's very easy if you study it, otherwise it will be a headache. Otherwise, I'll make you understand it so that it is very easy for you. See, if we see grey matter and white matter, this is nothing but your grey matter is your cell body and dendrites, means nuclei, all the nuclei which including your cell body and dendrites are your grey matter. Fine. This is your grey matter, and the axonal part is your white matter. Why it is grey and white? Anybody can tell me? Yes. Why it is grey or white? It's nothing but You know, in the axon we have the myelin sheath. This is your myelin sheath, right? So myelin sheath will give you the appearance of white color. So that is why it is called white matter. And in the cell body we do not have the myelin sheath. That is why it is give the appearance of grey color. So it is called your grey matter. Understand? It's very easy. Now you know the concept. White is called the grey matter and white is called the white matter. It's very simple. All the material which is the including your cell body and the nucleus which do not have the myelin sheath, so it gives the appearance of grey color, so it is called your grey matter. Otherwise the axonal part which has the myelin sheath gives the appearance of white color, so it is called the white matter. Simple. Is it any difficulty up to here, or is it simple? I'll make it simple for you. If you have any difficulty, so please let me know in the comment section. We'll make it more easy. See, now you understand the grey matter and white matter. Okay, we'll move to the next thing. After that we have the tracts, right? Tracts. Now we will study that what are tracts. If you see, we can wait. If you see the tracts, these are the white matter only. Okay. Okay, so what if you see the definition of the tracts, that what is tracts? Any guesses? Yes. Okay, see, tracts are nothing but these are the white matter which have white matter which has the common origin and insertion. Okay, common origin and insertion. See, if I draw the diagram here, midbrain, pons, medulla, your spinal cord, this is your cortex. Okay, so what are tracts? Tracts are running in the fashion of upward to downward and downward to upward. Means these have the common origin as well as common insertion. If we see, it originates from here and insert here. Fine. So these have the common origin and common insertion and running vertically in the spinal cord and the brain. Fine. So these are called your tracts. Any doubts? Okay, I have one question. See, these are the white matter bundle, right, or axonal bundle you can say, which are running vertically in the brain and the spinal cord and has the common origin and insertion. Write it down. It is very important definition of the tracts. So what are tracts? Tracts are the axonal white bundles. Write it down. Tracts are the axonal white bundles which are running in a vertical fashion in brain and the spinal cord and has common origin as well as common insertion. Fine. So tracts definition is clear. So let's move to another thing. See, for example, if I draw the brain here, you know that brain has the two hemisphere, your left hemisphere and your right hemisphere. Fine. My drawing is not that good, but just understand it. See, we have the left hemisphere and the right hemisphere. So the tracts are the one which are connecting the brain vertically. Fine. So if I ask you that what are the fibers that connect the brain left and right, what are these are also the white matter fibers only. So what are they called which connect your left hemisphere to your right hemisphere? What are they called? Any guesses? Please respond. Okay, pause the video and just write your answer in the comment section, so I will see you are studying or not. So these fibers are called your these are called commissural fibers. Okay, they are the commissures. So if I talk about that, we know that the tracts are connecting the brain vertically. Fine. Then commissure fibers are connecting the brain left to right. Now if I say I say that what are the fibers called which connect the brain from anterior to posterior? So this is anterior, this is posterior. Fine. What are these fibers called? So these are connecting the same side of the brain, means they are connecting from connecting the one nuclei to the another nuclei in the same hemisphere of the brain. So we can say it is connecting from anterior to posterior. So what are they called? These are called, yes, these are called your association fibers. Fine. Good. Now everybody, your concept of fibers is clear. Let's revise it. First we have studied your tracts. Good. Second is your commissural fibers. And third one is your association fibers. You have to understand it very nicely, because if you want to study the structural anatomy of the spinal cord and its physiology, you have to know the basics of it. Okay, otherwise you will got very confused. So what are the tracts? Tracts are connecting your brain in the vertical fashion, from up to down and down to up. So these have the common origin and common insertion. Fine. What are the commissural fibers? Your commissural fibers are connecting your brain. How? They are connecting your brain from left to right. Okay. And the last one which is left, your association fibers. These are connecting your brain from anterior to posterior. So these are called your association fibers. Clear? Okay. So then we will move to the next. So your situation and extent is also clear. Coverings are also clear. Segments are also clear. Spinal nerve roots are also clear. Gray matter and white matter, and then tracts. So we have seen the tract. If I just see, we have seen that tracts have the common origin and insertion, and it is running in the vertical direction. Don't think that I am making you bored by repeating it again and again. It is worth repeating. I am repeating it so that it sets in your mind. So if you know that the thing which is going up, it is called ascending, and which is coming down, it is called descending. So likewise the tracts which are running from your spinal cord to your brain, okay, from your spinal cord to your brain are called your ascending tracts. Fine. And the tracts which are taking the information from your brain and translating it to the spinal cord, means they are coming down, from your body, from your brain to your spinal cord. So these are called your descending tracts. Is there anything to learn it? Tell me, is there anything to learn it? You just have to remind that the tracts which are taking origin from your spinal cord and it insert in the brain, so they are moving upward, so these are called descending tracts. Simple. And the tracts which are taking the information from your brain and descending down to the spinal cord are called descending tracts. There is no need to learn in the neuroanatomy. You just only have to clear your concepts so that you understand it better, and you don't need to learn it. You have to name it according to the concept. Fine. So we will stop here and proceed to the next video. Before that, just learn it, and I will post one question for you, and I'll check that if you are studying or not. If you have just really study this video and concentrate it, you will able to respond this question. So for today's question is, what are the coverings of brain and spinal cord called? It's very easy, I think. If you have really studied it, you are able to answer this question. Neuron, your neuroglia, your receptors, or meninges. Answer it in the comment section and stay tuned with me. Watch my videos, subscribe it, and support me so that I can make you more videos so that you can easily understand the concept of the neuro. Thank you so much.